Welcome to MedFlash. Let's see gynecology one-liners. First one, anatomy and development. Mullerian duct is also known as paramesonephric duct. Gives rise to fallopian tubes, uterus, cervix, and upper four-fifths of the vagina. Wolffian duct is also known as mesonephric duct. Regresses in females. Remnants include Gartner's ducts, epiphran, and paraophran. Urogenital sinus give rise to lower one-fifth of the vagina, bladder, except trigone and urethra. Gubernaculum remnants becomes a round ligament and ovarian ligament in females. Uterine artery, a branch of the internal iliac artery, which is anterior division. Ureter artery and relation. The ureter passes under the uterine artery, which is water under the bridge. Most important MCQ. Ovarian artery arises directly from the abdominal aorta. Right ovarian vein drains into the inferior vena cava. Left ovarian vein drains into the left renal vein. Lymphatic drainage of cervix. Primary nodes are external iliac, internal iliac and obturator nodes. Lymphatic drainage of ovary drains directly to the para-aortic nodes. Lymphatic drainage of lower one-third of vagina drains to the superficial inguinal nodes. Pouch of Douglas, the lowest point of the peritoneal cavity in women. Valdeus fossa, the depression in the lateral pelvic wall where the ovary usually lies. So, ovary is present in the Valdeus fossa. Hymen, the junctional zone between the urogenital sinus and Mullerian ducts. Cervical epithelium. Ectocervix is stratified squamous and endocervix is simple columnar epithelium. Transformation zone, which is present in cervix, the area where columnar epithelium changes to squamous, most common site for cervical cancer. Bartholin's gland, located at the 4 o'clock and 8 o'clock position in the labia majora. So, Bartholin's gland is located at 4 o'clock and 8 o'clock position in the labio majora, not minora. Blood supply to the perineum. Internal pudendal artery. Nerve supply to the perineum, pudendal nerve, which is S2, S3 and S4. Supports of the uterus. The Meckenrod's ligaments are the primary supports, which is also called cardinal ligament. Uterosacral ligaments provide posterior support and maintain the uterus in an anteverted position. Anteversion, the angle between the long axis of the cervix and the vagina 90 degree. Anteflexion, the angle between the long axis of the body of the uterus and the cervix 120 degree. Pelvic floor, formed primarily by the levator ani muscles, which is pubococcygeus and puborectalis iliococcygeus. Perineal body, the central tendon of the perineum, 10 muscle attached here. Normal uterus size around 7.5 cross 5 cross 2.5 cross centimeter. Fallopian tube length approximately 10 centimeter. Ampulla is the widest part and site of fertilization. Isthmus, the narrowest part of the fallopian tube. interstitial or intramural part, the segment of the tube that passes through the uterine wall. Average menstrual cycle is around 28 days. Normal range is 21 to 35 days. Duration of flow 3 to 7 days. Average blood loss around 30 to 80 ml. Follicular phase variable length dominated by estrogen. Luteal phase constant at 14 days dominated by progesterone. First sign of puberty in girls is thelarchy, breast development. Thelarchy means breast development. Order of puberty in girls is thelarchy, and after that pubarchy, pubic hair, and after that growth spurt, and after that menarche, menstruation. Okay, and menarche age is average 12 to 13 years. LH surge occurs 30 to 36 hours before ovulation. Peak of LH occurs 10 to 12 hours before ovulation. Ovulation triggered by the LH surge. Release of the secondary oocyte at the time of ovulation. Corpus luteum secretes progesterone. If no pregnancy, it becomes corpus albicans. Dominant follicle chosen by day 5 to 7 of the cycle. Estrogen effect on cervix. Thin, watery, egg white mucus. Fern test positive. In estrogen effect, Fern test is positive. Progesterone effect on cervix. Thick and tacky mucus. Fern test is negative. In the case of progesterone, Fern test is negative. Spin barricade effect. Maximum stretchability of mucus at the time of ovulation. Mitral schemas pain means mid-cycle pelvic pain associated with ovulation. At the time of ovulation, there is a pelvic pain. It is called mitral schemas. Primary amenorrhea, absence of menses by age of 13 with no secondary sexual characteristics, or absence of menses by age of 15 with the presence of secondary sexual characteristics. Okay, understood? And most common cause of primary amenorrhea is Turner syndrome. Secondary amenorrhea, absence of menses for 3 months if regular, or 6 months if irregular. Most common cause of secondary amenorrhea is pregnancy. So always rule this out first with urine pregnancy test or beta-HCG. Okay. And most common pathological cause of secondary amenorrhea is polycystic ovarian syndrome. Asherman syndrome, intrauterine synechiae, diagnosed by hysterosalpingography or hysteroscopy. Okay. Causes of Asherman syndrome is due to DNC. Okay. And Sheehan syndrome, ischemic pituitary necrosis due to PPH. Hypogonadotrophic and hypogonadism. Low FH or LH plus low estrogen. Example, Coleman syndrome or stress or anorexia. Hypergonadotrophic hypogonadism. High FH or FSH or LH plus low estrogen. Example, premature ovarian failure or Turner syndrome. Turner syndrome 45X4, streak gonads, short stature, webbed neck, and increased FSH. Okay. Androgen insensitivity syndrome 46XY, phenotypic male, female, an absent uterus, testis present, usually intra-abdominal. Okay, and high testosterone. MRKH syndrome 46XX, absent uterus and upper vagina, normal ovaries, and normal secondary sexual characteristics. Premature ovarian failure, menopause before age 40. Menopause diagnosis, amenorrhea for 12 months plus FH level is greater than 40 international units per liter. Okay, and postmenopausal bleeding is must rule out endometrial cancer. Endometrial thickness cutoff in the postmenopausal woman is greater than 4 mm. Okay, if the endometrial thickness is greater than 4 mm, it requires biopsy. Most common symptom of menopause: hot flushes, hormone replacement therapy, most effective treatment for vasomotor symptoms, estrogen only hormonal replacement therapy only for women without a uterus to avoid endometrial hyperplasia. Okay, if it does not treated, means it will cause endometrial cancer. Combined HRT, estrogen plus progesterone for women with an intact uterus. Osteoporosis is in menopause due to estrogen deficiency. Gold standard diagnosis is DEXA scan. Bisphosphonates, first line medical treatment for osteoporosis. Genitourinary syndrome of menopause, vaginal dryness and atrophy, treated with local estrogen creams. Tibolone, a synthetic steroid with estrogenic, progesterogenic, and androgenic properties used in menopause. PCOS, Rotterdam's criteria, okay, must meet 2 of 3. So that's why we follow that Rotterdam criteria: hyperandrogenism, ovulatory dysfunction, and polycystic ovaries on USG. USG finding in PCOS is string of pearl appearance, 12 or more follicles, 2, 2 to 9 mm in size, like this. Okay, it shows like this one. Here is stroma. An LH-FH ratio in PCOS is often elevated 3:1. Drug of choice for ovulation induction is in PCOS letrozole, which is aromatase inhibitor. Metformin in PCOS is used to manage insulin resistance, not first line for ovulation. Okay. Infertility definition: failure to conceive after 1 year of unprotected intercourse. Primary infertility, never conceived. Secondary infertility, has conceived at least once before. Most common cause of female infertility is PCOS. Most common cause of tubal infertility is pelvic inflammatory disease. Hysterosalpingography performed on day 7 to 10 of the cycle to check tubal patency. Gold standard for tubal patency is laparoscopy and chromoperturbation with the use of methylene blue dye. Semen analysis, the first investigations in any infertility workup. After that, only we go hysterosalpingography for that tubal patency. Normal sperm count according to WHO 2021 greater than 15 million per ml. Azoospermia, absence of sperm in the ejaculate. Oligospermia, low sperm count. Keratozoospermia, abnormal sperm morphology. Asthenozoospermia, which is reduced sperm motility. Clomiphene citrate, selective estrogen receptor modulator, act on hypothalamus. Side effect of clomiphene is multiple pregnancy. mostly twins. Ovarian hyperstimulation syndrome, a serious complications of IVF or induction. Okay. Characterized by massive ovarian enlargement and third space fluid shift, like ascites and all. Intrauterine insemination, sperm is washed and placed in the uterus. In vitro fertilization, fertilization occurs in a lab dish. Intracytoplasmic sperm injection, single sperm is injected into an egg used for severe male factor infertility. Hirsutism, excessive terminal hair in female in a male distribution. Ferryman-Galway score used to clinically grade hirsutism. Score greater than 8 is significant. Hyperprolactinemia causes amenorrhea and galactorrhea. Drug of choice for hyperprolactinemia is gabagoline, which is dopamine agonist. Luteal phase defect, progesterone levels less than 10 nanogram per ml on day 21. Endometriosis related infertility due to pelvic adhesions and an altered peritoneal environment. Abnormal uterine bleeding. Pon-Coin classification. The FIGO classification for AUB. Form denotes polyp, adenomyosis, leiomyoma, and malignancy. In coin, non-structural, coagulopathy, ovulatory, endometrial, iatrogenic, and not classified. Most common cause of AOB in adolescence is anovulatory cycles. HPO axis immaturity. Most common cause of AUB in reproductive age is fibroids or PCOS. Most common cause of AUB in perimenopausal age is anovulatory cycles. Menorrhagia, heavy menstrual bleeding greater than 80 ml at regular intervals. Metrorrhagia, irregular bleeding between cycles. Polymenorrhea, cycles occurring at intervals less than 21 days. Oligomenorrhea, cycles occurring at intervals greater than 35 days. Hypomenorrhea, scanty bleeding at regular intervals. AUB ovulatory dysfunction, characterized by unpredictable, heavy bleeding, often seen in PCOS. Investigation of choice for AUB is transvaginal ultrasound. Gold standard for endometrial assessment, hysteroscopy guided biopsy. Pipple biopsy, an outpatient procedure for endometrial sampling, highly accurate for cancer. Medical management of AUB. First line is levonorgestrel intrauterine system or Mirena. Okay. Non-hormonal drug of choice for AUB is tranexamic acid. NSAIDs in AUB reduce blood loss by 20 to 40% and treat dysmenorrhea. Adenomyosis, endometrial glands and stroma within the myometrium. Okay. Clinical triad of adenomyosis, menorrhagia, dysmenorrhea, and symmetrically enlarged globular tender uterus. Venetian blind appearance is a classic USG sign of adenomyosis. MRI in adenomyosis shows a thickened junctional zone, okay, which is greater than 12 mm. Definitive treatment for adenomyosis is hysterectomy. Uterine fibroids, the most common benign tumor of female pelvis. Most common type of fibroid is intramural. Most symptomatic type of fibroid is submucosal, which causes heavy bleeding. Parasitic fibroid, a subserosal fibroid that loses its uterine blood supply and attaches to the omentum. Red degeneration occurs during pregnancy due to rapid growth and ischemia, treated conservatively with analgesics. Hyaline degeneration, the most common type of fibroid degeneration, sarcomatous change occurs in less than 0.5% of the fibroids. Suspect in a postmenopausal woman with a rapidly growing uterus. Drug of choice for medical management of fibroids, GnRH agonist. Myomectomy is a surgical removal of fibroids indicated for women wishing to preserve fertility. Otherwise, we should go for hysterectomy in the case of fibroids. Okay. Endometriosis, functional endometrial tissue outside the uterine cavity. Most common site of endometriosis is ovaries. Samson theory, retrograde menstruation, most accepted theory. Metaplastic theory or Mayer's, coelomic epithelium undergoes metaplasia. Clinical triad of endometriosis is dysmenorrhea, dyspareunia, and infertility. Characteristic finding on examination, fixed retroverted uterus and tender nodules in the pouch of Douglas. Chocolate cyst seen in endometriosis, an endometrioma of the ovary containing old thick blood. Powder burn lesions, characteristic appearance of peritoneal endometriosis on laparoscopy. Gold standard for diagnosis is laparoscopy for endometriosis. CA-125 in endometriosis often elevated but non-specific, used for monitoring. Medical management, first line in endometriosis is combined oral contraceptives or progestins. Okay. In progestins, Dynogest is highly effective. GnRH agonist in endometriosis create a pseudomenopause to shrink lesion. Surgical management, laparoscopic cystectomy or ablation of lesions. Danazol, an androgenic steroid once used, now avoided due to virilizing side effects. Definitive surgery, total abdominal hysterectomy with bilateral salpingo-oophorectomy. Powder burn versus red flame lesions, different visual stages of endometriosis seen during surgery. Dysmenorrhea in endometriosis usually starts 2 to 3 days before menses and peaks during flow. Deep dyspareunia indicates involvement of the uterosacral ligaments. Ground glass echoes classic USG appearance of an endometrioma. Risk of malignancy. Endometriosis is the risk factor of clear cell and endometrioid ovarian cancer. Pelvic inflammatory disease is an ascending infection from the lower genital tract. Most common causative organism for pelvic inflammatory disease is chlamydia trachomatis, which is most common, and Neisseria gonorrhea also causative organism for PID. Chandler sign, cervical motion tenderness, Fitzhugh-Curtis syndrome is perihepatitis associated with PID, shows violent string adhesions between the liver and diaphragm. Tubo-ovarian abscess, a severe complication of PID. requires aggressive IV antibiotics and possible drainage. Bacterial vaginosis, a shift in flora from lactobacilli to anaerobes. AMSEL criteria, which is used for bacterial vaginosis, it requires 3 of 4. So, what are the 4 is homogeneous discharge, pH greater than 4.5 and positive whiff test and clue cells are present. Drug of choice for bacterial vaginosis is metronidazole 500 mg BD for 7 days. Trichomoniasis caused by flagellated protozoan, sexually transmitted. Strawberry cervix seen in 10% of trichomoniasis case. Drug of choice for trichomoniasis is metronidazole. Single 2-gram dose must treat partner also. Okay. And vulvovaginal candidiasis caused by Candida albicans characterized by curdy white cottage cheese discharge. Drug of choice for candidiasis is fluconazole, single dose 150 mg or clotrimazole vaginal pessaries. Okay, which is cans of CL pessaries. And pH in vaginal infections or in the case of bacterial vaginosis and trichomoniasis is pH greater than 4.5. In the case of candidiasis is pH less than 4.5. Primary syphilis, hard chancre, painless and indurated ulcer. Chancroid, soft chancre, painful non-indurated ulcer with ragged edges caused by Haemophilus ducreyi. Lymphogranuloma venereum caused by chlamydia, characterized by the groove sign, which is important. Granuloma inguinale Donovanosis caused by Klebsiella granulomatis shows Donovan bodies on tissue smear. Genital herpes HSV2 multiple painful vesicles that ruptured to form ulcers. Zang smear shows multinucleated giant cells. Cervical ectropion outward pouting of the endocervical columnar epithelium normal in pregnancy and OCP users. Chronic cervicitis often characterized by Nebotian cyst. Genital warts, condyloma acuminata, which is caused by HPV types 6 and 7. Drug of choice for genital warts, podophyllin resins or imiquimod cream. Pruritus vulva, most common cause is candidiasis or lichen sclerosis. Lichen sclerosis are characterized by parchment-like or cigarette paper skin, high risk of progression to squamous cell carcinoma. Lichen planus characterized by the Wickham striae, white lazy lines. Okay. Bartholin cyst formed by the obstruction of the Bartholin's duct. Marsupialization, the surgical treatment for a recurrent Bartholin cyst. Ascending infection is the primary route for PID. PID outpatient treatment is ceftriaxone IM, doxycycline oral, metronidazole oral. Cervical cancer, most common gynecological cancer in India. Cervical cancer. Primary risk factor, persistent infection with high risk HPV 16 and 18. This one causes the cervical cancer. HPV 16 most common for squamous cell carcinoma. HPV 18 is common for adenocarcinoma. Cervical screening in India every 3 to 5 years for women aged from 30 to 65 years of age. And pap smear, a screening test, not diagnostic test, is a screening test, uses the Bethesda system for reporting. Low-grade squamous intraepithelial lesion usually corresponds to CIN1. High-grade squamous intraepithelial lesion correspond to CIN2 and 3. Colposcopy done if pap smear is abnormal. The gold standard for directed biopsy. Acetocyte epithelium area that turns white with 3 to 5% of acetic acid indicates high nuclear density. Mosaicism and punctuation, visual patterns on colposcopy indicating high-grade lesions. Skillless test. Lugol's iodine is applied. Normal cells turn brown, which is iodine positive, while cancerous cells stay pale, which is iodine negative. Figure staging for cervical cancer is stage 1A1 is microinvasive. Depth of inversion is 3 less than 3 millimeter. Stage 1A2 depth of invasion is 3 to 5 millimeter. Stage 1B1 is clinically visible lesion less than 2 cm. Okay. And stage 2A, which is involvement of upper two-thirds of vagina. Stage 2B, parametrial involvement. Stage 3B, extension to pelvic wall and causes hydronephrosis. Management of CIN1 observation, mostly regress. And management of CIN2 or 3 loop electrosurgical excision procedure or cold knife conization. Wertheim's radical hysterectomy includes removal of uterus, cervix, upper vagina, parametrium and pelvic lymph nodes. Indication for Wertheim's up to stage 2A1. Treatment of choice for stage 2B and beyond. Concurrent chemoradiation with cisplatin plus external beam radiation plus brachytherapy. Pelvic exenteration is ultra-radical surgery for central recurrence, involves removal of bladder, rectum or both. HPV vaccine Gardasil 9, which protects against type 6, 11, 16, 18, 31, 33, 45, 52, 58. 9 variants, okay. Vaccine schedule 2 doses at first dose and second dose at 6 months if started less than 15 years. If vaccine is started greater than 15 years, it must be 3 doses. Screening in pregnancy, use pap smear and colposcopy. Endocervical curettage is contraindicated in the case of pregnancy. Endometrial cancer, most common gynecological cancer in developed countries is endometrial cancer. Primary risk factor, unopposed estrogen, obesity, nulliparity, late menopause and tamoxifen use. Protective factors are smoking, which is decreases the estrogen, and combined oral contraceptive pills. Type 1 endometrial cancer, which is endometrioid, estrogen dependent and better prognosis. Type 2 endometrial cancer is serous or clear cell estrogen independent, which is aggressive. Lynch syndrome associated with a very high risk of endometrial and colorectal cancer. Most common symptom in endometrial cancer is postmenopausal bleeding. Investigation choice of endometrial cancer is fractional curettage or hysteroscopic biopsy. Figure staging of endometrial cancer 2023 update. Stage 1A, tumor limited to endometrium or less than 50% of myometrial invasion. Stage 2, tumor invades cervical stroma. Stage 3, local or regional spreads like ovaries, vagina, lymph nodes. Standard surgery for endometrial cancer is total laparoscopic hysterectomy plus bilateral salpingo-oophorectomy. Progestin therapy used for fertility sparing treatment in young women with grade 1 stage 1A cancer. Ovarian cancer, which is deadliest gynecological cancer due to late presentation. Most common type of ovarian cancer is epithelial. Serous is most common. BRCA1 and 2 mutations increases risk of serous ovarian and breast cancer. Protective factors are pregnancy, breastfeeding, and OC pills. Screening for ovarian cancer. No effective screening exists for the general population. Tumor marker for epithelial ovarian cancer is CA125. Tumor marker for endodermal sinus tumor or yolk sac tumor is alpha fetoprotein. Tumor marker for dysgerminoma LDH and HCG. Tumor marker for choriocarcinoma is beta HCG. Tumor marker for granulosa cell tumor is inhibin. Colexner bodies or pathognomonic histology for granulosa cell tumors. Samoma bodies seen in serous papillary ovarian carcinoma. Meigs syndrome, triad of benign ovarian fibroma plus ascites plus right-sided pleural effusion. Krukenberg tumor, metastatic signet ring cell tumor to the ovary, usually from the stomach or GI tract. Sister Mary Joseph's nodule, palpable nodule at the umbilical indicating metastatic intra-abdominal malignancy. Dermoid cyst or mature cystic teratoma is the most common benign ovarian germ cell tumor. Struma ovary, a dermoid cyst containing thyroid tissue, can cause hyperthyroidism. Risk of malignancy index based on CA125, menopausal state, and USG futures. Primary cytoreductive surgery, the goal is optimal debulking. Chemotherapy regimen is paclitaxel plus carboplatin. Pseudomyxoma peritoni, jelly belly caused by rupture of the mucinous tumor. Brenner tumor characterized by vaulted cell nest. Tumor type and its marker. Immature teratoma, the marker is alpha fetoprotein, lactate dehydrogenase, and CA125. Granulosa cell inhibin. Choriocarcinoma, beta HCG. Epithelial tumor, CA125. Dysgerminoma, LDH. Yolk sac tumor, alpha fetoprotein. Contraception. Pearl index. What is meant by Pearl index? Number of unintended pregnancies per 100 women years of use. Most effective reversible contraceptive is Implanon. Least effective method is barrier method or natural methods. Combined oral contraceptive pill primary mechanism is inhibition of ovulation by suppressing FSH or LH. Estrogen component in OCP is usually ethinyl estradiol. Progesterone component in OCPs varies by generation. Example, levonorgestrel, drospirenone. Centromin or Saheli, a non-steroidal, non-hormonal serve taken twice a week for 3 months, then once a week. Emergency contraception drug of choice is levonorgestrel 1.5 mg within 72 hours or ulipristal acetate 30 mg within 120 hours. Most effective emergency contraceptive is copper T IUD within 5 days. Copper T 380A is effective for 10 years. Marina effective for 5 to 8 years. Normally 5 years only we allow. Reduces menstrual blood loss, which is drug of choice for abnormal uterine bleeding. What is it? Marina. Mechanism of IUDs primarily causes a local sterile inflammatory responses, which is spermicidal. Ideal time for IUD insertion is within the 10 days of start of menstruation. Post-placental IUD inserted within 48 hours of delivery. Contraindication for IUD, unexplained vaginal bleeding, PID or Wilson disease. Progesterone only pill primary mechanism is thickening of cervical mucus. DMPA, Antara program, injectable contraceptive given IM every 3 months. Major side effect of injectables, irregular bleeding, spotting and amenorrhea. Amenorrhea in OCP users known as post-pill amenorrhea. OCPs and cancer. Reduce risk of ovarian and endometrial cancer. Slightly increase risk of breast and cervical cancer. Absolute contraindication for combined OCPs are smokers greater than 35 years, history of DVT or stroke, liver disease, active breast cancer. OCPs and surgery should be stopped 4 weeks before major elective surgery due to DVT risk. Female sterilization, which is also known as tubectomy, most common method in India. Pomeroy's technique is the most common in female sterilization. Laparoscopic sterilization uses Filthy clips or fallope rings. Male sterilization is also known as vasectomy. No scalpel vasectomy is the standard. Vasectomy success only confirmed after 2 consecutive sperm-free semen analysis, usually 3 months later. Condoms, the only method that protect against both pregnancy and sexually transmitted infections. Diaphragm must remain in place for at least 6 hours after intercourse. Lactational amenorrhea method only reliable for the first 6 months if exclusively breastfeeding. Pelvic organ prolapse. Descent of pelvic organs due to weakness of the supports. Cystocele means prolapse of the bladder into the anterior vaginal wall. Urethrocele means prolapse of urethra. Rectocele means prolapse of the rectum into the posterior vaginal wall. Enterocele, herniation of the pouch of Douglas. Presidentia, third degree prolapse. Entire uterus is outside the introitus. Pelvic organ prolapse Q system, the standardized objective system for staging prolapse. Stage 0, no prolapse. Stage 4, complete eversion or presidentia. Fothergill's operation used for young women with prolapse who want to preserve the uterus. Ward-Mayo's operation, vaginal hysterectomy with pelvic floor repair for postmenopausal women. Leford's colpocyclisis, closing the vagina, used for very elderly women who are not sexually active. Stress urinary incontinence, involuntary leakage on coughing or sneezing. Gold standard for stress urinary incontinence is mid-urethral slings. Boney's test, elevation of the bladder neck to stop leakage. Arch incontinence, leakage preceded by a sudden, strong urge. Drug of choice for urge incontinence, antimuscarinics. Vesicovaginal fistula, continuous trickling of urine. Most common cause of vesicovaginal fistula in developing countries are obstructed labor. 3 swab tests used to differentiate between vesicovaginal fistula and ureterovaginal fistula. Vulvar cancer, most common type is squamous cell carcinoma. Paget of the vulva present as red, eczematous, itchy lesion associated with underlying malignancy in 20%. Vulvar intraepithelial neoplasia, precursor to vulvar cancer, associated with human papilloma virus 16. Behcet syndrome, recurrent oral and genital ulcers plus uveitis. Vaginal cancer is rare. Most are metastatic from the cervix. Sarcoma botryoides, grape-like mass in the vagina of young children. Gardner's duct cyst, remnant of the Wolffian duct found on the anterolateral wall of the vagina. Imperforate hymen leads to hematocolpus. Hematocolpus means blood in vagina and hematometra means blood in uterus. Hematocolpus clinical sign, bulging bluish membrane at the introitus plus cyclic pain. Primary dysmenorrhea, pain with no identifiable pelvic pathology due to excess PGF2 alpha. Drug of choice for primary dysmenorrhea is NSAIDs like mefenamic acid. Premenstrual syndrome occurs in the luteal phase. Symptoms resolve with the onset of menses. Drug of choice for severe premenstrual syndrome is SSRIs or fluoxetine. Vaginismus, involuntary spasm of the pelvic floor muscles treated with behavior therapy and dilates. Hirsutism versus virilization. Virilization includes clitoromegaly, deepening of voice, and increased muscle mass. Most common cause of virilization is androgen secreting tumors, McCann-Albright syndrome, triad of precocious puberty plus polyostotic fibrous dysplasia or cafe-outlet spots. Precocious puberty, development of secondary sexual characteristics before age 8. Delayed puberty, no characteristics by age 13. If the sexual characteristics are not present by age 13 is delayed puberty. Fractional curettage separates scrapping of the endocervix and endometrium, essential for staging endometrial cancer. Dilation and curettage, most common complication is uterine perforation. Signs of perforation during DNC is sudden loss of resistance or instrument passing deeper than the measured uterine sound length. Hysterosalpingography timings day 7 to day 10 of the cycle. Hysteroscopy media is carbon dioxide for diagnostic or glycine or a normal saline for operative. Glycine toxicity can lead to hyponatremia and fluid overload. Laparoscopy primary port, usually the umbilicus. Veress needle used to create pneumoperitoneum. Pneumoperitoneum gas is carbon dioxide is used because it is highly soluble in blood and non-combustible. Intra-abdominal pressure during laparoscopy should be maintained between 12 to 15 mm mercury. Shoulder pain after laparoscopy due to diaphragmatic irritation by residual carbon dioxide. Myomectomy, Bonus myomectomy, removal of fibroids. Primary risk is massive hemorrhage. Bonus hood, a technique using the uterine serosa to cover the incision site in posterior wall myomectomy. Hysterectomy types: total hysterectomy, subtotal and radical hysterectomy. Ureteral injury site. Most common site of injury during hysterectomy is at the level of internal os. Bladder injury. Most common injury during LSUS or vaginal hysterectomy. Colposcopy, green filter used to highlight the vascular pattern of cervical lesion. Cryotherapy uses nitrous oxide or carbon dioxide to freeze the transformation zone. Conization, diagnostic and therapeutic, involves removing a cone-shaped piece of cervix. Shirodskar cerclage requires bladder mobilization. McDonald's does not. Latchko operation, extraperitoneal repair of a vesico-vaginal fistula. Kelly's plication used for the treatment of stress urinary incontinence. Shirodskar sling for nulliparous prolapse using a Merceline tape. Vaginal hysterectomy position is lithotomy position. Contraindication for vaginal hysterectomy is large uterus around greater than 12 to 14 weeks of size, suspected malignancy or restricted mobility. Uterine sound used to measure the length and direction of the uterine cavity. Hagar's dilator used to dilate the cervix. The number represents the diameter in millimeters. Sim speculum, a double-ended retracted for the posterior vaginal wall. Cusco speculum, a self-retaining bivalve speculum, best for visualizing the cervix for a pap smear. Valsalum, used to grasp the anterior lip of the cervix. Green Armitage forceps used to hold the edges of the uterine incision. Carmen's cannula used for manual vacuum aspiration. Manual vacuum aspiration pressure creates a vacuum of 600 mm mercury. Endometrial ablation, a less invasive alternative to hysterectomy for AUBE. Assure, a permanent hysteroscopic tubal sterilization method, now largely discontinued due to side effects. Hydrotubation, injecting fluid into the tubes to check or clear patency. Culdocentesis, aspiration of fluid from the pouch of Douglas, which is used for suspected ruptured ectopic. Laparoscopic entry, which is also called Palmer's point, used in patients with previous midline scars located 3 cm below the left costal margin in the mid-clavicular line. Thermal balloon ablation uses heat to destroy the endometrium. Internal iliac artery ligation reduces pelvic arterial pressure by 85%. Nerve involved in lithotomy injury, which is common peroneal nerve, which leads to foot drop. Clomiphene citrate, antagonist at the hypothalamus, blocks the negative feedback of estrogen. Letrozole is aromatase inhibitor, prevents peripheral conversion of androgen to estrogens. Tamoxifen, antagonist in the breast, agonist in the uterus. Tamoxifen increases the risk of endometrial cancer. Raloxifene, antagonist in the breast and uterus, agonist in the bone, which is used for osteoporosis. Danazol used for endometriosis and hereditary angioedema. Mifepristone, progesterone antagonist used for medical abortion and fibroid. Ulipristal acetate, selective progesterone receptor modulator used for emergency contraception and fibroids. Cyproterone acetate, anti-androgen used in PCOS for hirsutism. Spironolactone, diuretic with anti-androgenic effects used for hirsutism. Finasteride, 5-alpha reductase inhibitor used for hirsutism, highly teratogenic. GnRH agonist, leuprolide or goserelin causes flare initially, then downregulation of receptors. GnRH antagonist is cetrorelix, immediate suppression of FSH or LH. Cetrorelix has no flare effect, but that GnRH agonist has flare initially. Advac therapy giving low dose of estrogen progesterone with GnRH agonist to prevent bone loss and heart flashes. Fragile X premutation associated with premature ovarian failure. Swyer syndrome 46XY with mutation in the SRY gene, streak gonads, female phenotype. Kallman syndrome, hypogonadotropic hypogonadism plus anosmia, failure of GnRH neurons to migrate. Noonan syndrome, male Turner's 46XY with features similar to Turner's, webbed neck and heart defects. Sertoli Leydig cell tumor causes rapid virilization in women. Ringis crystal pathognomonic for Leydig cell tumors. Dysmenorrhea versus dyspareunia. Dysmenorrhea is painful periods and dyspareunia is painful intercourse. Vaginismus drug of choice is behavioral therapy or dilators. Perimenstrual dysphoric disorder is a severe form of premenstrual syndrome treated with fluoxetine. Fitzhugh-Curtis syndrome, perihepatitis with violent string adhesions, actinomycosis associated with long-term IUD use, Brunner's tumor, Walthat cell nest looks like transitional cell epithelium, Yolk-Sac tumor, pathognomonic Schiller dual bodies, dysgerminoma, female equivalent of seminoma. Dysgerminoma is highly radiosensitive. Tumor marker for dysgerminoma is LDH. Meg syndrome, benign fibroma plus ascites plus pleural effusion. Pseudomyxoma peritoni associated with mucinous tumors. Struma ovary, teratoma with thyroid tissue which causes hyperthyroidism. Krukenberg tumor, metastasis from stomach to the ovary. Dermoid cyst, mechoteratoma, most common complication is torsion. Cervical cancer screening start from age 30. Cervical cancer screening stop in India for age 65. Hematocolpus, blood in the vagina. Hematometra, blood in the uterus. Hematosalpinx, blood in the fallopian tubes. Cryptomenorrhea, menstrual blood occurs but is hidden. Example, imperforate hymen. In the case of imperforate hymen, we can give cruciate incision. Vicarious menstruation, cyclical bleeding from extragenital sites. Sunday's test used for diagnosing urinary fistula. Methylene blue test used to detect vesicovaginal fistula. Moyer's test, another name for the 3-swab test. Marshall-Marchetti cramps, an older surgery for SUI. Birch-Calpo suspension is laparoscopy or open surgery for SUI. Pessary of choice for prolapse is ring pessary. Pessary for presidentia is gel-horn pessary. Stress incontinence surgery drug of choice is transobturator tape. Cervical cancer staging is primary clinical. Endometrial cancer staging is surgical and ovarian cancer also surgical. Most common benign tumor of the vulva is hydroadenoma. Most common malignancy of the vulva is squamous cell carcinoma. Skin glands, female equivalent of the prostate. Bartholin glands, a female equivalent of Cowper's gland. Labiomajora, female equivalent of the scrotum. Clitoris is a female equivalent of the penis. Round ligament passes through the inguinal canal. Ovarian reserve best measured by anti-Mullerian hormone or antral follicle count. The golden tip is in any gynecology MCQ. If a patient is postmenopausal and she has bleeding means your first step is endometrial biopsy.